Hi, Mr. Williams. Welcome back.
Hi, how are you?
How you feeling today?
I feel pretty good. Yeah,
Okay.
thank you. I read through all the information. I had a couple questions, if you don't mind.
Sure. Let's start with this.
Okay. Well, one, I heard that the treatment is really bad, and I'm real concerned about getting sick.
Yeah.
Is it really bad? The treatment?
It can be, but I want you to back up a little bit. I first want to go over your lab work.
Okay.
Okay. Before we get into some more things about possible treatments. I know it's a lot to take in, and when you start reading it can be overwhelming.
Yeah.
But the first thing I wanted to tell you was it's true you do have hepatitis C. You do have the chronic form.
Oh, wow.
So you weren't one of those people that cleared it.
Okay.
And when we look at the hepatitis, we look at the viral load, which is how much hepatitis you have.
Okay.
And that's not really indicative of how much disease your liver has.
All right.
It's just a number that we use when we do treatment to see that you're responding.
Okay.
But we also looked at the type of hepatitis C you have.
Okay.
There's 4 different types of hepatitis C.
Okay.
1, 2, 3, and 4. And 1 is the most common.
All right.
And that's the one you have.
Okay.
Unfortunately, it's also the hardest to treat.
Oh, okay.
But that's kind of what we expected. Most people have the genotype 1, so type 1.
Okay.
So that's the kind that you have, and you do have it. We also looked at your liver function, how it's functioning,
All right.
and your enzymes, the chemicals in your body that show how your liver's functioning,
Okay.
were a little bit elevated. They weren't extremely elevated, and we don't know what exactly that could be from. They're not specific to knowing whether it's from the hepatitis C or whether it's from the drinking.
Wow.
So that's something that we can look at and monitor.
Okay.
And we also looked at the HIV, and it seems like your counts are holding up, even though you haven't been doing everything you're supposed to do.
What was my viral load CD4?
Your viral load was 80,000,
Oh, wow.
and your CD4, your T cells, were 305.
Oh, wow. Okay.
So not super low, but not where we want them.
Okay. They were higher before.
What were they before?
Yeah, they were like 500.
Okay, that's the goal, 500 and up.
Yeah.
So we got to get you back on that.
Oh, wow.
What medications were you last on?
Before I was taking Rayataz and Norvir and Truvada.
Okay,
Yeah.
those aren't bad medications.
Okay.
But we might start you on something that would work with hepatitis C meds, and so in the future, if we're going to treat your hepatitis C, there wouldn't be any interactions.
Okay.
So we'll talk about that later, and I'll send that to the pharmacy.
That was my other question, because I wanted to know if I take HIV medicine, would that cause any problems with the hepatitis C medicine?
You can take them both,
Okay.
and it's possible to be treated while you're on the HIV. But first, we want to get your HIV under control.
Okay.
We still have some series of tests in preparation before we do the hepatitis C.
Okay.
But the HIV we can start treating today.
Oh, great.
So I'll call the medications Icentrus and Truvada to the pharmacy, and I'll talk more about you after about how to take those meds.
All right.
So going back to your blood work, you have hepatitis C, and we went over the HIV, and we're going to monitor those liver enzymes. But we can't really say, this is a little example of how your liver could look. And we want your liver to be looking like this, like a nice piece of meat. But when it starts to get scarred, it looks a little bit like this. And it can't do its jobs of filtering and manufacturing proteins your body needs. And then when it starts to die, it looks like this. Okay? And we don't really know from just the blood work where you're at. So today we're going to do a more specific test called a FibroSure. And it takes some different things in your blood and kind of comes up with a proposal about how much changes or how much scarring, we call it fibrosis, that you have.
Okay.
In the olden days, we used to recommend a biopsy.
Okay.
And a biopsy is the only sure way to know exactly which stage your liver is in.
Okay.
But to spare you that for now, we're going to do this blood screening test, and that'll give us a range.
Thank you.
It's not super accurate, and it can miss things, but it gives us an idea.
Okay.
So that, in combination with the other tests that we've done, will give us an idea of how your liver is looking.
Okay.
The one imaging scan or visual scan we can do of your liver is an ultrasound.
Okay.
So we'll also set that up today. And that's a non-invasive test. They put the jelly stuff on your liver, and they look to see if there's anything that looks like scarring, or if there's any masses that'll look for that.
Okay. Great.
Okay.
All right.
So those are some of the things we're going to do today.
Okay.
Now going back to your question about the treatment.
Yeah.
What else have you heard besides making you sick?
I heard, well, I work, and I heard that I could be really tired, and I can experience like a loss of appetite, and just a lot of different things that could really affect me when I go to work. So I was really concerned. I mean, do I have to take off of work when I'm on hepatitis C treatment? Like, I'm just really concerned about that.
Yeah, it's a lot of great questions. The hepatitis C meds do make you pretty sick. I'm not going to sugarcoat it.
Okay.
The medicines are no joke. But it's different. It's different than the HIV. With HIV, as you know, we're controlling the virus. And you know, you're going to be on these meds probably for the rest of your life.
Okay.
Unless we come up with a cure, which would be exciting.
Right.
But for now, you're going to be on the HIV meds and you're controlling the virus. With the hepatitis C meds, you're actually curing it.
Oh, right.
So these medications are curing it. It's a short treatment, 6 months to 12 months, where you're actually eradicating the virus. And at the end of it, you can say you don't have it anymore.
Wonderful.
So it's really an exciting treatment, but we want to build you up and get you ready so that you're strong enough mentally and physically to succeed in going through this treatment. So we're not going to start it tomorrow.
All right.
I'll give you more information today.
Okay.
Your type, genotype 1,
Genotype 1.
you need 3 different medications.
Oh, wow.
So
Okay.
it's the shot that you mentioned once a week.
Right. Oh, wow.
And that's the one that can make you a little
Right.
tired.
That's what I heard.
And there's 2 different sets of pills.
Okay.
And they can make you tired too. They can make you itchy, give you rashes.
Okay.
And the shot can also make you a little bit depressed.
Oh,
So it's a lot.
okay.
It's a lot to think about.
Yeah.
But like I said, we're in no hurry to treat you.
Okay.
We're going to continue to talk about it, continue to check out how your liver's going. We're going to have you speak with the behavioral health consultant again today
Okay.
to see how the drinking's going.
Okay. All right.
And also to talk to you a little bit about any possible depression. We want to get a good idea of how you feel about your mood now before we start the medications, because it may affect your mood.
Oh, wow. Okay.
Okay, so how is the drinking going?
Well, since talking to a behavior specialist, it has gotten better. I'm not drinking every day. I'm not taking a shot every day, and I'm learning different things that I can do to not drink as much.
Okay,
Yeah.
great. Have you ever talked to anybody about the hepatitis C, or were you waiting to get the labs back?
I was really waiting to get the labs back.
Okay.
But, you know, I have to go to work soon, so I really have to get ready to go.
Okay, let me give you a little bit more to read now that you know that you have hepatitis C. I'll give you this to look over, and we're going to do those things we talked about, and I'll see you in a couple more weeks.
All right. Thank you very much.
Take care.
All right. See you.